Spacebound Entertainment presents The Horrors of Methamphetamines. Methamphetamine users. Addiction touches nearly every family, ranging physical and mental health, relationships and personal finances, mothers, fathers, brothers, sisters, daughters, and sons. No one is immune to the frightening long-term impact of the hard drug abuse. What follows is a sober depiction of real individuals who've fallen victim to temptation of drug use. In this case, methamphetamine, whose devastating effects are all too apparent. The first thing you notice in a meth user is their skin. Acne appears or worsens. Obsessive skin picking often causes meth users' faces to be covered in small sores and scarring, the result of a common sensory hallucination of bugs crawling beneath the skin. The next thing you'll notice is facial musculature and fat. Meth, like other stimulants, suppresses appetite and can lead to undernourishment due to long periods without eating. Over time, the body begins consuming muscle tissue and facial fat, giving users a gaunt, hollowed-out appearance. Another noticeable sign is their teeth and gums. Meth mouth is caused by several factors. Tooth enamel is dissolved by harsh chemicals of the drug. The blood vessels contained in healthy gums and teeth shrink, increasing the rate of decay. The production of saliva diminishes, allowing harmful acids to further damage the mouth. Cravings for sugary foods increases with meth use. Oral hygiene is typically neglected while high, and heavy tooth grinding is an additional side effect of the drug. One of the easiest ways to notice somebody who does meth is by looking at how old they are and how they look. Increasing estimated age is a side effect of meth. The combination of skin issues, facial fat and muscle loss, hygiene neglect, and increased oral decay lead to the appearance of exaggerated aging, sometimes shockingly so. Here is an overview on crystal meth. The crystalline form of methamphetamine, often referred to as crystal, ice, crank, or simply meth, is a powerful addictive man-made drug which is typically snorted, injected, or swallowed. It is a powerful stimulant, causes a high that can last up to 12 hours, and has appetite-suppressing properties that have made it appealing, particularly upon women. However, tolerance to crystal methamphetamine occurs rapidly, causing the user to take increasing amounts or more frequent doses as they chase a diminishing high. Severe physiological and psychological addiction invariably take hold at this point. Because of the process by which this form of methamphetamine is manufactured, crystal meth is full of harsh chemicals, impurities, and additives that make the drug especially dangerous. Some symptoms and signs of a meth addict. During methamphetamine use, a person's pupils become dilated, their heart rate increases, and they may show signs of physical exertion, such as sweatiness and elevated body temperature. They may seem particularly agitated, nervous, or frustrated. Because it is a strong stimulant, users will often go for long periods, possibly even days at a time, without sleep and a diminished appetite. Looking gaunt, drawn, or undernourished is frequently a cause for concern, even if it isn't an indicative of a drug addiction. But when coupled with other symptoms of meth abuse, these signs should be taken very seriously. Over long periods of addiction, the harsh chemicals in the drug cause oral deterioration, often termed meth mouth, and skin health also suffers as increased acne and sores from skin picking begin to appear. If you know somebody that wants crystal meth addiction treatment, here's a little bit of information for you. The process of treating meth addiction is similar to other serious drugs, such as cocaine, heroin, or alcohol. A patient will generally start with a course of detoxification to flush any traces of meth from the body over a course of a few days. The damage the drug has done to the body can take much longer, however, depending on the addiction severity. After detox, a course of inpatient or intensive outpatient rehab should follow. With a higher than average possibility of relapse, residential crystal meth treatment is often recommended for crystal meth abuse over outpatient services to ensure treatment is highly regimented and properly administered. 60 to 90 days of long-term therapy is typically recommended. After finishing rehab, a patient will want to build their relapse prevention skills, which is why 12-step aftercare programs should be considered by recovering addicts. Recovery is a lifelong process that one can be achieved with the proper help, support system, and determination. If you or anyone important to you is currently suffering from drug addiction, please seek help immediately. Go to rehabs.com for more information about addiction recovery programs that will fit your individual needs. Make sure you guys share this on all social medias, including Facebook, Twitter, even on your own YouTube by liking it, just so people who are addicted can get some help and understand what's going on with their body when they do meth. Remember, one share or one like can save a life. If you are currently seeking help, go to rehabs.com for more information.